Thank you, Vijay.
Thank you. We can go live. Yes.
Yeah, sure.
Live start right. Yeah, Vinod, you can start the session. Very good evening, everybody.
Live varla sir.
Vandarje, live Vandarje, you can start.
Okay, sir. Thank you. Sir, very good evening, sir. Sir, very good evening, sir. Thanks for joining us for this webinar. Very good evening to all the emitted doctors. Thank you so much for joining us for today's webinar. Our endeavor to spread awareness about rabies, which is fatal but can be avoided once appropriate vaccinated. This is an initiative from Kedila through this innovation to the society and humankind. The topic of the webinar is novel 3-dose G protein vaccine unlimited key of complaint. Dear doctor, rabies is the world's first novel 3-dose anti-rabies vaccine, and with a great pride, we would like to inform you that rabies has successfully completed 1 year launch with more than 40,000 animal bites victims. Being the vaccinated, 100% complaints was recorded and no case for AD or was registered. With this, it is my honor to introduce you to speak of today's webinar.
Is it over, Vinod?
Yes, sir. Yes, sir. Sir, now I am introducing you, sir. Dr. Sriram Anish, sir, is MBBS and DA, MD, GM, PG, and Diploma in Diabetics. Sir, Sarah has completed MBBS 2000 and Sarah has experience more than 25 years. Yes, sir. And doctor was working in assistant professor internal medicine, Tanjavur Medical College. Right. Sir, thank you, sir. I will hand over you to sir. Thank you.
Thank you, Vinod and Vijay Pandian for the nice introduction. I'm more pleased to have this opportunity about rabies vaccine. So kindly unmute all the other participants, possible, because it's like.
Sir, hope you are able to hear now. There is no distraction there.
Yeah. To the technical team, kindly unmute all other participants.
Please mute everybody. Vinod, I think. I think everybody is mute now, sir.
Okay, fine.
I'll also mute myself. You will be able to go without any problems.
Okay. So thanks a lot. So as you said, this rabies potentially lethal infectious disease, mainly carried over by the dog bites, rabid dog bites, also from the bats. So previously, we got many number of vaccines. Most of them are neural-based vaccines. But now we are traveling in a non-neuronal based vaccine. That too, to avoid all the vaccine-induced complications like encephalitis. That is number one. Number two, so what is the dosage of this vaccine? Are the patients are really, compliant with all the dosages of vaccine? That also has to be looked in, because previously when the vaccine was started, it was introduced with multiple doses. Now it has been reduced to 5 doses regimen. And then this is yet another, innovation, introduction, invention by your Cadila team that is only constituting 3 doses, only just 3 doses, right? So dosage reduction strategy in rabies. With this novel vaccine, this particular vaccine has proved its efficacy in adults as well as in pediatric communities. So obviously we can use minimal side effects. Let's see what are all the benefits. Yeah, the content of my talk would be some points about rabies disease and what is the epidemiology in India and across the globe, and what are the real challenges that are unmet. Challenges are being, multiple injections of rabies doses. Currently, we are using is 5 doses. Are the patients really, putting all the full regimens? It is a challenge that is unmet. If you reduce the dosage like only 3 doses, obviously the adherence to the vaccine will also be in the full form, so that the patients might be, adherent to the treatment. So now today we are going to see about the 3-dose regimen of this particular vaccine from Cadila. So what are the phases it has been passed through? So all these things we can see today. Yes. So before that, for sake of postgraduate and undergraduate, one should know what is the structure of a rabies vaccine and what are the antigenic properties they have. Yes. So it's of course a zoonotic disease transmitted by either your bat animals or your dog and other species. It is encoded by 5 structural proteins: P protein, M protein, N protein, L protein, and of course the RNA and the G protein. This is the major G protein, it's the envelope protein. It's a major antigen in the formation of neutralizing antibodies against the vaccine. So this particular G protein is a highly antigenic, and today we have molecule we are going to speak about is addressing this particular area. Yes, so rabies, as you all know, it's a lethal disease. Around 55 to 60,000 of people across the globe are dying due to rabies death across the globe per year. So over 150 countries, it has been, spreading. And again, 40% of the population of rabies are in the pediatric age group. So this is the information from the epidemiology across the globe, and the sources being your infected dogs as well as your bats, especially in North America. So you see, this particular disease is 100% preventable. You know how? But for, you're 100%, if the patients are 100% vaccinated, and then you're going to prevent 100%. So that carries the importance of this particular disease. Probably, as I said previously, that is the data. And in India, around 20,000 of people acquiring this rabies are dying per year. That is the pathogenic situation. It carries more than 1/3 of the global, death rate of this community. And again, 90% of the death is from the rural areas. So what are the symptoms of rabies? As you all know, the fever, like any other virus fever, it produces all the constitutional symptoms. The incubation period, they say, from 1 to 3 months. Within a period of a rabid dog bite, patients might experience all these symptoms, constitutional symptoms, plus the main hallmark symptoms being your hydrophobia and your aerophobia, fear of water and air. So what about the dogs? Of course, they say if anyone bit by a dog has to be observed for a period of at least 10 days. So what are the symptoms you can expect if the dog is a rabid dog? So the dog may have changes in attitude and behavior, and the barking quality might be changed, and the dog might have dropping jaw, excess salivation, excess excitability, and of course aggressiveness in the dog and unable to swallow. So one has to observe all these characteristics the dog as well for a period of 10 days to confirm that the dog is really a rabid dog. How exactly travels from the animal to the humans? First of all, it bites from the from the saliva of a rabid dog. It enters the tissue, then the muscle, and then of course the peripheral nervous system, and then into the central nervous system. And then it's an ascending infection into the spinal cord, and finally your midbrain area, and of course the cerebral cortex, your basal ganglia area, and then it produces rabies encephalitis. Then it goes to the saliva of the humans victims. From there also it spreads to other humans. So a rabid dog to human bite, human to human transmission, not updated most of the cases, whereas dog to human transmission, it's observed across the globe as well as in India. So the rabies encephalitis is a progressive and fatal lethal complication as the endpoint of the rabid dog, and the differential diagnosis would be meningitis. For the sake of postgraduates, any patient who coming in a state of coma, you should consider also other conditions like your HSV encephalitis, your meningitis, Japanese JE, intravirus encephalitis, and of course Chandipura in the endemic areas. Prophylaxis, as you all know, the pre-exposure is just day 0 and day 7, whereas the PEP is post-exposure prophylaxis. This is what currently we are following: 5 doses, 0, 3, 7, 14, and 28. Whereas we are the rabies immunoglobulin, that is RIG, it has been given in terms of your equine immunoglobulin, immunoglobulin, and your human immunoglobulin. It's a RIG, which it should be given within a period of 1 week. It is 20 international units per kg in human immunoglobulin, and 40 international units in case of your human immunoglobulin. These 2 immunoglobulins are available in the market. So this is the 5 doses. That is a PEP, that is post-exposure prophylaxis. So what is the key emphasis we have to give on? The emphasis is, this particular prophylaxis, see 5 injections we are giving, and see to that the patients are adhering to all the injections. So as I said previously, the rig is being delivered by your equine rig and your human rig. Prevent this rabies, which has to be constituted over a period of 1 week. Within a period of 1 week after vaccination or after dog bite, you should give this particular rig, that is rabies immunoglobulin. Beyond the period, of course, it's not going to help because the vaccines are going to produce the antibodies. So you have to give either 1 week within vaccination or you have to give 1 week within the bite. So that is the information key recommendations. Of course, what is the category of dog bite for which you have to give vaccination? So the category 1, as you all know, it's just touching the skin is intact. So maybe the dog may be a rabbit dog, but if your skin is intact, and again, there is no need of any prophylaxis. What about category 2 and category 3? In category 2, the skin is having, uncovered skin. Uncovered skin in category 2 and category 3, whereas minor scratches or abrasions without bleed in category 2, whereas in category 3, your membrane breach, your skin breach, and everything is there, even if it might be landing up in lacerations and more than that. Injuries may be beyond that. So category 2 and category 3 are the one who need your vaccination and your rig. In category 2, it's your vaccination and local care of the wound is sufficient, whereas in category 3 wound, you need your vaccination as well as your rig. Again, the same. So the category 2, if the patients are non-immune, there is no prophylaxis needed in category 1. In category 2, the patient is non-immune, you have to vaccinate 0374 doses IM and rig is not indicated. Whereas in category 3, your vaccination as well as your rig is indicated. The vaccinations are 4 to 5 doses as well as your rig is indicated in category 3, as I said previously. So what about the patient is already, re-exposed? So in already re-exposed, sorry. So even if the patient is already re-exposed to the vaccine, see, less than 15 days, time after previous vaccination is less than 15 days, the schedule is complete, so no vaccine is recommended. Whereas in 15 to 90 days, the previous dose of vaccination, the vaccine doses again are not recommended. Whereas after 90 days, if the patient is bit by a dog after vaccination, you need 2 doses of vaccine. This is the scenario. It has to be tailored according to the days the patient presents to you. So in the case of rabbit bite, so never be panic. What are the measures you want to do? Remember, you have to observe the characteristics of the dog for a period of 10 days. As I said previously, the dog is more aggressive, and again you have to vaccinate and give your rig based on your categorization of your wounds, and then you have to wash the wound thoroughly for 15 minutes with COVID and iodine and soap and water. This is the main first aid, whatever things you are doing as you are following previously. So remember, rabies is 100% fatal, but 100% vaccine preventable. So that is what all these companies and your Indian government are emphasizing to create awareness about this particular vaccine and rabies day. So this is the journey of the invention of the rabies vaccine. In 1885, all these things, the next vaccine was invented in 1911. These two are your nervous tissue-based vaccines. The complications being vaccine-induced encephalitis and vaccine-induced all the newest complications are there. So to prevent that, nowadays we are focusing on your cell culture vaccines, and that too, it has been invented from 1976. We are using 5 injections or 4 injections of this particular cell culture vaccine. So of these, this is the invention. Now it has been reduced to 3-dose vaccines by your recombinant technology by the Cadila team. I would like to appreciate the team for this invention so that the patients will adhere to the treatment. So what is the thing? So the current rabies vaccines are your cell culture vaccines, that is the CCV. The thing is, previously it is inactivated vaccines and more than half a decade of a century vaccine, So it's inconsistency in its potency in terms of your chain availability, adverse effects, more adverse effects, 5 doses. So decreased compliance beyond 3 injections. That is observations. They observed that first 3 injections the patients are adhering, and then the rig. So after that, the patients are missing the 4th and 5th injections. That is observations made across the globes. So this is observations. So non-compliance is a major issue beyond 3 injections of the particular vaccine. So this is the unmet medical need. So whenever, obviously, if the dose is for 4 or 5 injections, unless you complete the full schedule, you're not going to have the titers, antibody titers. It should be more than 50 international units. So if you fail in giving the fourth and fifth injections, obviously patients is not going to be fully immunized. So how you are going to meet this unmet need? You have to select the novel vaccine, which has got a simpler and shorter regimen. So this particular Cadila rabies vaccine is going to meet that area, gray areas. This is prepared by the recombinant G, as I said previously, the G protein based recombinant technology. The first protein separate vaccine, it is based on VLP platform technology. So what is VLP? VLP is nothing but virus-like particle. It is not at all, highly, it is not at all pathogenic, pathogenic, whereas it is antigenic. Let us see in the next slide. Yeah, so this is the native virus. So currently, this particular rabies vaccine is based on your VLP technology. VLP, as I said previously, it's virus-like proteins existing in nanoparticles. G protein from this particular rabies vaccine lies isolated by the VLP technology and purified by this Cadila Limited Pharmaceuticals Limited, and then this particular they cannot. So the VLPs, as I said previously, they do not contain the viral genome. That's very important. So if they contain the viral genome, they got the adverse effects also very severe. They may produce neuritis, they may produce encephalitis, or they may produce myelinitis. But this particular vaccine has got only the G protein, that is a VLP virus-like particle. It is not contained in the genome, whereas it contains the antigenic property without being pathogenic, and thereby it produces strong humoral and cellular immune response, and hence this is made into a vaccine. So what is the evidence? The evidence says the research made being in Ahmedabad study in 2021. It proves that this particular molecule in 3 doses has got the antibody titers to the maximum to make the patient, protective. So let us see what is the data. The data it has been compared with the competitor molecule, say Rabipur. This particular 50 microgram of dosage, this particular Tharabis made by the Zadila group is compared between the competitor of Rabipur. They're given on 0, 3, and 7 days. Let us see the observations. The observations being the 50 microgram is this yellowish area. So see, after day 180, it is equipotent, and at the day 270, the potency or the seroprotection is very, very high. So it is not inferior to the routine conventional vaccines. So with the dose of this phase 2 data or phase 2 study of this particular rabies proved that is equipotent to the competitor in terms of your seroprotection. So what about the phase 3 trial result? The phase 3 trial, it proves the safety. Always it has to prove the safety and the efficacy. The safety of this particular recombinant nanoparticle vaccine administered in PEP prophylaxis has been studied in multi-center studied, it has been studied more than 800 subjects and randomized across to, with Rabipur. Compared with Rabipur, it's a 0 3 7 day regimen, whereas Rabipur is a 5 day regimen, and the subjects given is around 533 subjects have been given with the Tharabis, and 267 is given with your Rabipur vaccine. So this is the comparative, multicentric, and randomized study, and the efficacies and the observations are being like this. So it demonstrates the non-inferiority of this particular Tharabis vaccine. Subjects, the primary objective was the subjects' seroprotection at the end of 2 weeks after the first dose. The seroprotection titer was more than 0.5 international units. Remember, if you want to check the seroprotection, you have to check the rabies vaccine titers, antibody titers. If it is more than 0.5 international units per ml, then you are protective. So it has been proving after 2 weeks study. So what are the secondary objective? The secondary objective at the end of 42 days after the first dose of test vaccine, it again proves that it has got lesser adverse effects. In terms of your efficacy, the primary objective, and in terms of your lesser side effects, this particular molecules has been proving positively, so that it has got a significant seroprotection even after days together after the first dose of vaccination. Thereby, this particular 3-dose vaccine has proved that it's effective. The results being Tharabis has got this particular safety. This is the Tharabis blue, the comparison. So seroprotection, it has been around 99 or 98% after a period of 42 days. And again, this is the percentage of adverse effects. Tharabis is greenish pillar. So lesser adverse effects, lesser pain, lesser redness, lesser fever, lesser headache, lesser joint pain, lesser nausea. So overall, lesser adverse effects. That is, it has proved its secondary composite point, and primary endpoint, it has proved its seroprotective. So remember, with this particular 3 doses, this particular molecule Tharabis has proved its efficacy. The conclusion being, Tharabis was non-inferior to a routine Rabipur or any of the vaccines available in the market, and it's got lesser side effects. It has got significant antibody titers, and again, it has been safe and immunogenic compared to your 5 doses of your pre-qualified WHO vaccine. Now onwards, you can, because the 5 doses, most of the patients are 50% of the patients are non-adherent, or they're losing their compliancy, or they miss the doses, 4th and 5th doses. So if you give 3 doses vaccine, definitely the patients are going to get adhere. So this particular molecule has claimed the Pharma Innovation of the Year and the Golden Globe Tigers Award. So obviously, this is the vaccine of the era. So in near future, if you follow this particular vaccine, 0 and 3 doses of vaccine, 0, 3, and 7, within a 1 week time, you're going to immunize the patients against this particular, rabies vaccine, disease, as well as your immunoglobulin. So you can give the RIG as well as this vaccine within 1 week period and make the patient immunized and stay away from the disease and help the patients prevent this particular disease. As I said previously, the World Rabies Day is marked on September 28th, as on every year, create awareness about this particular dogs, stay away from the dogs. There are certain funny slides I came across, if your dog doesn't like someone, you probably should not either also. Also, we can learn kindness from the dog. The world would be a nicer place if everyone had the ability to love as unconditionally as a dog, because everywhere we are in lack of love. So dogs never lie about love. Love yourself the way your dog loves you. And of course, you are going to be happy. So then last remember slide is, so how you are going to prevent the dog bite? You stay away from the dog animals, stray animals, avoid contact with the bats as well. So important to vaccinate your pets. So remember, you have to vaccinate your pets also. And then, so this is particular disease is preventable by 100% preventable vaccine. So the aim is 0 death by 2030. To achieve that, you have to follow all these things. So this is the latest theme of 2023, all for one and one for all. So one for all, you have to prevent this rabies by 2030. For this, everyone has to create the awareness, everyone vaccinate your pet animals, everyone stay away from stray animals, and then that is the opportunity for me. I hope I have rendered the justice to the topic. Thank you for the opportunity, and thank you to the attendees.
Thank you so much, Dr. Sriram Ganesh, sir. It was indeed a wonderful presentation, very, very vivid, very lucid, and you made it more interesting with your slides. So I am sure the audience, like me, would have definitely enjoyed your talk, because it was very much required. As you rightly highlighted about a rabies-free India, which we are looking at, the government's movement towards the 2030 complete eradication of rabies from India. Cadila is definitely committed to the doctor fraternity to join hands with you in helping the people actually get eradicated of this fatal disease. Thank you so much, sir. And sir, there are a lot of questions which just come in. So we had a wonderful participation this evening. So I'll just post a few of the questions to you, sir. So first question is, doctors want to understand what are the signs and symptoms they need to look for a rabbit patient.
Yeah, of course. The signs and symptoms, it's a viral borne disease. Obviously, for like any other viral disease, it produces the incubation period. They say, whenever you are bitten by a dog, over a period of 1 to 3 months, if the dog is having actively, aggressively rabbit virus in its saliva, or if it's a rabbit dog, then it produces symptoms within 1 to 3 months, right? The symptoms being common to any other rabies virus, it may produce your constitutional symptoms like fever, okay, your nausea, vomiting, your sore throat, your joint pain. So this is the common symptoms. So once when you have to be alarmed is, if it after a period of 2 or 3 months, the patients are producing any of the central nervous system symptoms like numbness or your severe hydrophobia, fear of your air hunger, fear of your air, fear of your drinking water. These are the alarming symptoms saying that the patient is definitely having rabies, and it is, death is unpreventable. So before that, you have to give one. If you're bitten by a dog, but whether it is a rabies dog or a non-rabbit dog, within a period of 1 week, if you fall into the category of 2 or 3, wise to watch the wound thoroughly and to give the vaccine, 3-dose vaccine set by your Cadila team, 0, 3, and 7, and of course, your rabies immunoglobulin as early as possible. Thereby, you can prevent the rabies. Otherwise, if the rabies are producing symptoms like your aerophobia or hydrophobia, so no one can prevent your death. That is it.
One more question is that, sir, how do you look at this compliance part from your side, sir? Do you think the patients are compliant with the existing 5-dose regimen, or is your like in your clinical practice? How do you see this compliance? Are people adhering to the schedule, or how it is? Sir? Are they taking it lightly?
So obviously, it's very difficult, nowadays, because previously there was no rabies immunoglobulin. So they have to adhere to, previously they say around the umbilicus you have to put 14 injections. Remember how painful it was. But now the days have gone. So people, they are putting 3 to 4 injections or 5 injections. So if you give the correct awareness, as far as my clinic, my experience speaks. So we usually refer the patients for rabies immunoglobulin. Only the vaccine schedule we are giving, right? So the vaccine schedule, we are putting a diary form or a calendar form, and then we are giving alarms to the patients. Thereby, they are coming to the clinic and they are putting the vaccine. So I don't find any non-compliance. But the patient says, sir, it's really to stop with 3 doses. They fall into category 2. So in category 3, of course, 100% are adherent to the regimen. In category 2 areas only, they are asking queries like, sir, whether I can stop on day 4 or day 4th dose or 5th dose. So for these categories, whatever it is, so of course, this particular 3-dose regimen is going to do tremendous improvement in terms of adherence to the injection, and thereby we can prevent rabies. Thank you.
Thank you, sir. Sir, there is one question interesting question from doctors. They want to know about your personal experience of treating patients, sir.
Of course, so now still in countries like we are a developing country, in developing countries, still we are lacking in creating awareness among the public. In diabetics, now we are competing with China to beat your, not only in population, we are beating China in terms of a diabetic community. The reason behind is, they are lacking the awareness. So likewise, in dog bite also, most of the dog bites, 90%, see, I put a slide in, the epidemiology. 90% of the Indian dog bite categories are, in the rural population. In rural population, unfortunately, we cannot penetrate in terms of your creating the awareness against awareness of putting vaccination. So in urban population, obviously, they are coming straight away. And even if the dog is licking, they are coming for vaccination. But in rural communities, still we are lacking in creating awareness because simply they're neglecting. Once they see a single person of a family suffering from rabies in a closed room, nobody going near to him, spitting the saliva like a dog, like a rapacious dog. If anyone of the family experiencing that particular scenario, only they are creating, stepping forward to get vaccine. Otherwise, still we are lacking in rural populations in terms of awareness. So obviously, we are getting cases once in a month or even a fortnight in medical colleges acquiring with full-blown rabies. But of late, but for this, many programs are being conducted by the Indian national government. So in the last 6 months, a period, retrospectively, I can remember only a few cases of rabies we are getting even in medical colleges. So of course, we are traversing in an area of good sort of awareness, and still people are getting more vaccinated to this particular, rabbit dog bite. So still we are traversing in a positive way. Hopefully in 2030, definitely we'll be seeing rabies-free India.
Thank you, sir. Thank you for those insights. I'm sure, sir, actually, if you see the last couple of weeks at least, the media is actually having a lot of articles being published. There are a lot of documentaries being shown in the TVs regarding stray dog bites. If you see last week in Shankaran Koil, there was almost 60 people bitten by a single dog in 3 villages. That was a big news. And I think almost 3 villages it has traveled and bitten whoever it has actually come across.
Sir,
Yes, you are right.
So, Vijay, sir,
Thank you for the opportunity. If there is no
In between.
queries,
For the interruption. I think if I'm not wrong, it is in Kodumudi. There was a dog, single dog has bit people on the road. So I think these are all really very scary news that come across, and I'm sure a compliant, dosage compliant rabies vaccine like rabies is definitely going to help all the people. And thank you so much for this very informative talk this evening. And all of us, all of the people across, we had more than 60 participants in this today's meeting. I'm sure it was a wonderful information and a very informative talk. Thank you so much, sir. Thanks for your time. And as you rightly highlighted, rabies has been the most innovative drug category award by the Economic Times. It has been awarded. And we also won the Innovation Tigers Award at Malaysia. So thank you so much for all the recognition from the doctors also across. So we have already treated more than 2 lakh dog bitten cases across the country, and we are looking forward to serve more people who have been bitten by any animal for that matter. Thank you so much, sir. We join you in this crusade for rapid free India by 2030. Thank you so much, sir. With this, we all can log off. Thank you so much.
Thank you,
thank
sir.
you, Vijay. Thank you, Vijay, and thank you, Vinod, and the entire Cadila
Thank you,
team
sir.
for giving this nice molecule, so that we can prove this latest theme, in rabies, health for all. So for rabies-free health, this particular molecule might be a trendsetter. Thank you for the opportunity, and thank you for the patient attendees. Good evening, one and all.
Thank you, sir. Thank you a lot, sir. Thank you,
Great,
sir.
great.
Technical support we have done, so you can end the session. You can end the live.
Okay.
Thank you, sir. Thank you.
Thank you. Thank you very much.